what exactly is pneumonia?
So pneumonia is an infection of the lungs. That's the basic definition of pneumonia. It can be a viral infection, it can be a fungal infection, it can be a bacterial infection. So when it comes down to pneumonia, it's simple infection of the lung.
And how can someone exactly get pneumonia?
So we breathe in a million things each breath. People carry infections in their nose, in their mouth. There are people who are sick that we come in contact with on a daily basis. So it may be as simple as breathing in some of those bacteria or viruses. Sometimes it may be hygiene, and sometimes it may be low immune system. The lung itself carries a lot of bacteria as part of its natural anatomy, physiology. So sometimes when your immune system goes down, those can act up and cause pneumonia.
And what are some of the symptoms? Let's just say someone feels like, hey, I think something's up in my lungs. What are some signs?
So it starts off with very simple things. It could be as simple as cough with phlegm production. It can be fevers, chills, rigors. It can lead to chest pain, breathlessness, low oxygen content in the blood, people feeling sick all the time, and sometimes it can lead, if they persistently have low oxygen, they can be dizzy. The blood pressure can go down in the later stages.
And now, how can pneumonia exactly develop into sepsis?
So sepsis, again coming back to the definition, is a body's inflammatory response to a infection. That's called a sepsis. So when there is an infection in the body, in this case we're talking about pneumonia, so when there's an infection in the lung, it releases toxins, and that body reacts to those toxins, and unfortunately sometimes it overreacts, and when it overreacts, that is called a sepsis. If there is organ damage, that is called a sepsis.
And so I have to ask, when is it, if you feel like, hey, something's up with my body, and you think, hey, or we have a family friend who might says, hey, that you might have some symptoms going on. I guess, when is it the best time to say, hey, you need to go see a doctor at a minimum about what's going on with you?
So when the symptoms persist, right? If you have a thought in the head, hey, should I go see a doctor? The answer is yes, because there is certainly something more happening than what you realize. But if you start off as a simple cough, it goes away, then not as much as a concern. But if it starts off as a cough, then it progresses to phlegm, then you have fevers and chills and chest pain. So any of these alarming things, you need to definitely call your physician or seek some help.
And what is the best treatment?
So it is simple if dealt with early. Okay. So I look at pneumonia and sepsis as not a 1 or a 0. It's not on or off. It's a spectrum. So earlier in the disease, you can intervene, the better it is for the outcome. For pneumonia, the best treatment is antibiotics, early recognition, and right kind of antibiotics at the appropriate clinical stage. Again, there's the choice of antibiotics depends on the patient, their immune system, and how long they've had it for, what are the symptoms they have, if they have any lung damage in the past, and so on and so forth. When it comes to sepsis, early recognition, hospital visit, ER visit, fluids, maintaining the blood pressure, supportive care, antibiotics in the first hour of going to the hospital is very important.
All right. I want to kind of go back just to pneumonia.
Sure.
So I was doing some reading, kind of getting ready.
Yeah.
I was reading it, and there's some vaccines for it. I guess, can you talk a little bit about that?
Yes. So we do certainly have a few vaccines for certain bacteria. It can range from our yearly flu shots that we talk about to pneumococcal vaccine. We generally call it as pneumonia vaccine. The misconception is we think pneumonia vaccine covers all pneumonias. That is not true. Pneumovax or pneumonia vaccine covers one particular bacteria, which is the most common kind in certain population, especially age more than 65 or have underlying lung problems. So if there is a vaccination available and it's well proven, then that tends to reduce the severity of the pneumonia or stop it from progressing to sepsis. So there are a few vaccines.
All right, and so this is my last question.
Yeah.
When it comes to kind of preventing pneumonia,
Yeah.
what are your best tips? Say, if you want to try to make sure this doesn't happen to you.
Sure. First thing is, like you mentioned, vaccinations. That's the what we look at, what we can do for ourselves. Next is hygiene, right? Washing hands and things like that. The next is preventing exposures. If you know someone is sick or someone has a viral infection, staying at least 6 feet away from them prevents some of those infections. Early recognition. Some patients have developed bronchitis without pneumonia, and that may lead to pneumonia. So we want to stop that from progressing. So seeking help in the earlier stages definitely prevents this progression.
So let's just start off. What exactly is pneumonia, and I guess what are the kind of symptoms that are connected to it?
So pneumonia is, in essence, inflammation of the lungs, usually caused by an infection. Um, with inflammation in the lungs come symptoms including cough, chest pain, and difficulty breathing. Other things, depending on the cause of pneumonia, will be fevers, generalized malaise, and complications such as the ones that we may be discussing here in a little bit.
All right. So then I kind of want to, kind of dive into, how exactly can the infection that leads to pneumonia occur?
So there isn't a single infectious agent that causes pneumonia. There are actually pneumonia can be caused by various bacteria or viruses. Typically, those viruses and bacteria will first survive in your upper airways, usually in your sinuses, in your back of your throat, nasopharynx. And then incidentally, they make it down into your lungs. And if they grow to a high enough level, causing your body to react to their presence, that's when inflammation starts and you get the symptoms of pneumonia. Depending on what agent is causing pneumonia is how you get pneumonia. You could get it from others, from communicable diseases such as the flu and certain bacterial infections, or you could get it from the environment that can also cause a lot of respiratory problems.
Mm. And before we talk about some of those complications, I wanted to, I mentioned earlier, of course, some of these select vaccines are available for select agents. I guess can you kind of delve into that a little bit, and I guess how it can help you when you may be fighting this infection?
Absolutely. So, respiratory infections are historically one of the leading causes of death in humans prior to the use of antibiotics, and it's still one of the leading infections to today. So, there are multiple vaccines that actually are specifically designed to target the historically common causes of pneumonia. Streptococcus pneumonia or pneumococcus is the most common one, and there are various vaccines available for that. Typically given to children, but also for adults over the age of 60, 65. And the good thing about that is that, especially with children, those the bacteria that is being targeted also causes middle ear infections, also causes sinusitis, so you reduce the incidence of that. Then there's other bacterial vaccines out there, such as the Haemophilus vaccine, and then the pertussis vaccine, all of which are targeted towards these respiratory bacterial problems. And then the yearly vaccine that you get for the flu, uh, that's actually important because it can cause pneumonia directly, but more importantly, getting severe flu predisposes you to getting a secondary infection with a bacteria. So by reducing the flu, you actually, or reducing the flu severity, or even its possibility of onset with a vaccine, you also reduce your chances of a secondary bacterial infection. I want to make a special plug about vaccines in that it's not just for your own protection that you get a vaccine. One of the things that vaccines also helps with is with the transmission. All these bacteria and viruses I've talked to you about are things that are transmitted human to human, but if you are vaccinated, you are much less likely to transmit it to those around you. So if you have a grandfather or grandparent who is more prone to these severe complications from these type of infections, by you becoming vaccinated, you actually help those around you reduce the chances of them becoming infected as well.
That very important, and I want to kind of now switch gears a little bit because pneumonia, and we've seen a case of this recently, can turn into a I guess would it be fair to call it I guess a more deadly infection with sepsis? Recently in the public eye. I guess can you talk about how and why like pneumonia will kind of develop into that potentially?
So if we could start with, like, I guess defining what sepsis is. So sepsis is actually an out of control, no otherwise normal response to an infection. So when our body is consistently protecting us from overwhelming infection, it's just that in some occasions either the infection gets so far ahead of and our body needs to really mount a big response, or in other situations we're not 100% sure, but what happens is basically our defense systems kind of get out of control in a never ending loop that eventually leads to our own bodies damaging itself while it's trying to fight off this infection. And sepsis can occur with any infection in our body. This comes from urinary tract infections, it comes from major skin infections, and it can also come from pneumonia. But the larger the burden, and especially if the infection that's in your lung gets into your bloodstream, the higher the chances of you developing sepsis are. So it really is, as we explain to our patients, that sepsis is a normal response from our body. It's just when happens at an abnormal level that then leads to damage in other parts of our body that otherwise wouldn't be there.
Mm. And so I have to ask then, let's say you currently have pneumonia, you're currently fighting it, but you feel like something's going wrong. I have to ask then, basically, what are some signs pneumonia is basically turning into, a sepsis?
Definitely, as is implied with the fact that your whole body is on high alert, you will feel a lot worse. The typical signs of sepsis are fever, elevated heart rate, elevated respiratory rate. You take more breaths than usual, and just generalized malaise. It's usually a sign that things are crossing over to that more systemic response to the infection you may have. Now, the one of the challenges is that sepsis is not a on-off switch. It is a spectrum of severity, and even though you may become septic for a little while, your body clears the infection on its own. Versus what becomes runaway sepsis that can kill us is not very always clear. But when in doubt, talk to your doctor, talk to your medical provider in order to figure out what is the best course of action for treatment.
And so that was basically leading into my next question. I guess for pneumonia and then kind of going into sepsis, when are the signs where it's like, okay, it's time to go see a medical professional?
So everyone is a little bit different, of course. And first of all, I hope you don't mind that my dog is kind of barking here in the background.
No, no
Uh,
problem.
all right. Everyone is a little bit different when it comes to at what point should they seek their provider. Sepsis, on and of itself, the risk of complications from sepsis increase if you have underlying medical problems and uh, including age, or extreme youth, including diabetes, things like that. So everyone has to have their own individualized like threshold. But I do want to say that a phone call to your doctor's office is never a problem. And if you're ever in doubt, giving them a call is probably the way to go. If it gets to the point where you are unfortunately not able to do your normal daily functions, then that would be a situation in which you would have to go to the emergency room just to make sure there's nothing else going on.